If you live in the real world, you want to hear what Dr. Bruce Rubenstein has to say.
If you live in the spiritual world, you will want to hear what Rabbi Shea has to say.
We may agree,
And we may disagree.
but you want to hear both views.
So let's get right to it.
Welcome to another edition of the Rabbi and the Therapist. In this episode, we'll be talking about, perhaps one can say, the danger of prescription drugs and not getting addicted to those drugs. Yes, they're needed, and as a rabbi, we know that we have to follow our doctor. Torah tells us we have to follow our doctor's advice. We have to follow our doctor's advice if it comes to nutrition, exercise, as well as anything medical. And therefore, people sometimes say, well, my doctor gave me this prescription, it must be a drug that I need. But there is a danger, and unfortunately we see it more often than we are aware of, and that is that people get addicted to prescription drugs. So in today's episode, we'll be talking a little bit about that, what we can do when a person feels that, am I in a danger zone? Is there something that I have to speak to my doctor again? Is it something I have to call my rabbi perhaps? And what we can do.
Absolutely. Well, apropos, you yourself are suffering from back pain today, aren't you? So I'm sure that if you went to certain doctors, they could easily write you a prescription for a medicine that could get you addicted to narcotic painkillers, which at this point is sort of an epidemic of opioid addiction in the United States. There's another class of medications, prescription drugs that people do get addicted to. Sedative, we call them sedative hypnotics, medicines to go to sleep with and to reduce anxiety.
So you're saying that there's only a certain group of prescriptions that we have to worry about?
Essentially, the biggest problems fall into those categories, those two categories, narcotic painkillers, opioid painkillers, and sedative hypnotics. And unfortunately, many people get prescribed both, and they have an additive effect, and the risk of death from the combination is exponentially higher than one or the other, but even each one separately is high enough.
So one would ask the question, why are the doctors writing these prescriptions to begin with? Do we not have alternative, perhaps medicines that are not addictive or not so powerful or not so dangerous if one takes extra pills?
Yes, there are a number of different painkillers that are effective and that are non-dependency forming. There are certain situations when narcotic painkillers are necessary. The level of pain is so severe we have to give it. That's the only thing that is actually going to be effective.
And how does the doctor know that, in fact? Maybe I'm bluffing you. Maybe I just, either I was told about that medication or...
That's usually not how it starts. It usually starts by someone who either enters hospital with some kind of trauma, a broken limb, or actually the other source of the beginning of these things is when people go to the dentist and they have some kind of procedure that we know is going to cause a certain amount of pain. Dental problems can be extremely painful, yes?
Yes.
Right. So that's usually how it starts. This is one area of addiction and prevention of addiction that in the end, it's not like the person was going out looking to get high. That's not how this starts, right? It actually starts quite innocently. I think that the main point of prevention here is for the person to recognize when it has stopped being used for its original analgesic property and effect, and now someone has developed tolerance to it and has become addicted to it, to be able to know how to not get to that point, and if you feel like maybe you are, how to stop that process.
It's interesting because from time to time, we will hear about perhaps an elected official, a politician who all of a sudden was taking drugs, and it really started with this. They had backaches, they were in a car accident, God forbid, and because that, or other personalities around the world, again, we don't want to mention them by names, but unfortunately that they got to the point where they were addictive to that particular drug or that particular prescription. The question is, so how do I know if I'm on, my doctor prescribed something for me, how do I know that I'm in the danger zone?
The telltale signs of knowing that one is in the danger zone is that one is using more than prescribed. So you're running out of it before it's due for a refill. That one is craving it, and that the effect is lessening in some sense. You're developing tolerance to it. And that one starts engaging in other ways of procuring it. So let's say the doctor gives them 30 tablets in a month and they use it up after 15 days. They go to another doctor to try to get a prescription, right? Sort of working around that system. Those are kind of the...
By the time you're going to another doctor, you know you have a real problem.
Yeah, no, you definitely have a problem. It's not always necessarily severe. In its most severe, I would say that you definitely know it's in a severe form if, for example, you were given these narcotic painkillers and then you are unable to obtain more. We do have a database, by the way, where we can see all controlled substances that are filled. And if you go to another doctor, if the doctor bothers to look at the database and sees that you won't get it, then people start resorting to things like street heroin and all of the rest of it. As far as the sedative hypnotics, you have a problem if you start, if your doctor won't give you any more, and then you start asking for friends or family members for it, or for them to go to a doctor to get it. But again, it starts very innocently. People don't intend to get addicted to these things, but it unfortunately ends pretty badly for many
I think
people.
another barometer for this would be as follows. What is your desired outcome? Remember, they are called painkillers. If my desired outcome is not to have pain, then you're probably using it correctly. But if my desired outcome is I'm getting into a euphoric feeling, I'm taking these pills, they're making me feel good, I think that, to me, would be the first red flag that, hey, you may be overusing it.
You're 100% right. We also know one other thing about them, that once you start using them regularly, it lowers what we call the pain threshold. So if that slap is sufficient to cause pain for which you need a painkiller, okay, after you've used it for a while, you only need a little touch, and that causes the same sensation of the same intensity of pain as if you're being slapped.
Right. But that would be then the doctor would notice that quicker than the person
Unfortunately,
themselves.
they don't, which is why I think, frankly, rabbis could be of much greater help in helping congregants and those that come to them, and just generally with this question, to alert people to the fact that not all doctors are savvy to this or bother answering those questions. They're busy, they just write the prescription, to alert people to the fact that this is a very slippery slope, and that there are many, many alternatives to opioid painkillers, as there are many alternatives to sleep medications and anti-anxiety and sedatives and things like that.
So it would start, what I would say is, with a educated customer, ask questions when your doctor is giving you a painkiller or some type of help to help you go to sleep. Hey, doc, I want to know, is this something that can be addictive? I think that's where it starts. And the second thing, I think, again, if you were talking about rabbinic advice, self-awareness. The real question is, are we self-aware? And sometimes, doctors will ask questions. I know I'm not a very good patient. My doctor will ask me, well, does it hurt? When does it hurt you? I'm not necessarily self-aware that much, but it is in fact very, very important to be self-aware. So when you tell your doctor, I'm only having pain at this particular time, or only with these particular activities, sometimes the medication would really be a different medication.
Mm-hmm. Well, I think also that rabbis can be attuned to this, because people that are getting into that danger zone will tend to, number one, talk a lot about their pain. So if you notice that. The other thing that is noticeable are mood swings. So if you start seeing...
If it affects their general mood.
It absolutely affects their brain and the way they think and their feelings, absolutely. Just like it lowers their physical pain threshold, it lowers their threshold for any kind of discomfort. So I've seen this, I've unfortunately even seen it once at my own synagogue where there was a congregant and everyone started to notice these mood shifts which seemed to occur quite rapidly, and it was several months after this individual had surgery, and someone finally put together that, the fact that these were related and it was likely due to these painkillers as well. It's really, really a very serious problem, as you and everyone knows, because when the dependency and addiction sets in a very, very serious way, then you start seeing very unfortunate outcomes, not only because the supplies of things are being spiked with things like fentanyl, but that's when we start seeing deaths, and which is a very, very unfortunate outcome, which causes extreme pain to the families and friends for a lifetime. Way before you get there, I think that the rabbis as well as communities could do a much better job at educating people that we have many alternatives out there, medication alternatives out there, but that the addictive potential of painkillers and sedative hypnotics is so powerful and it can happen so quickly that up front you should really go to your doctor and say, give me all the alternatives before I need that, right? If I absolutely need it, I'll take it. But as fast as I can then get myself onto something that's not addictive.
So the rabbi has to do his part to make sure that the people say Tehillim, and that will definitely cure. No, but on a serious note,
you shouldn't have said that so quickly, because I think that actually prayer, and this has been borne out in clinical studies, that prayer actually hastens recovery and also puts a person in a state of mind where their subjective sense of pain is less. So to the extent that rabbis are able to encourage people to increase their I'd say their contemplation or their focus, although when you're in pain, sometimes maybe it might be a little more difficult to focus, yes. But then that's where a rabbi or a good friend who will pray with you could come in to help you refocus all the time. And I think that then people's use of these medications would decrease tremendously. Yeah.
This model that we spoke of, would that change if we're talking about youngsters, if we're talking about kids that are in pain? And what particular advice would you give to parents who, if my son or daughter is taking some type of painkiller and I'm concerned, or at what point should I be concerned? Remember, kids their tolerance for pain is also...
Yeah, we don't give... Narcotic painkillers and these sedative hypnotics are not given very extensively to children. Really only with, real severe cases of real severe pain, very bad fractured limbs, people with sickle cell anemia and sickle cell crisis. There's certain categories. What we're seeing in terms of addiction in children and adolescents of these types of medications almost always starts with recreational use, where they're buying these pills to get high, essentially. And that's where we see it in children and adolescents. This situation is much different in adults, where the risk is much higher as well. Yeah.
So, as far as my child, just being attentive to my child is an important thing, but as far as the adult, you'd say self-awareness, ask your doctor questions, ask that extra question that will really let you know what the story is. And if you don't need the painkiller, then don't take it.
Correct. Yeah. I think as you probably remember, the old school is like, do as the doctor tells you to do. The doctor might write you the prescription, but you don't necessarily have to take it. And you can ask for medications which don't have any addiction potential whatsoever, and you'll be in a much better place. Absolutely.
Well, thanks for listening to another episode of the Rabbi and the Therapist. Please, if you have any questions, make sure you can contact us. Send us an email and we will try to address that in a future episode. My dear friends, wishing you all the best and thanks for listening.